a financial stronghold of your family. If that family member is lost because of a substandard medical error, I think there should be a way for a family member to be compensated for that pain and for that suffering.
For the loss, for
Yes.
the loss of a loved one.
Yes. Now, I'm not going to say that that financial compensation is going to make you feel 100% better, and it's not going to make you whole again. But what I think it may do is deter the next person from being injured in that same way or dying
Well, it also
or suffering that
has
death.
to do with accountability. That
Yes.
right now, as far as I can see, when a senior citizen dies because of negligent treatment, there's no accountability. The wrongdoers just continue moving along the same path.
Yeah, well, I hope that doesn't happen. I agree with you that sometimes it does, but that's where different organizations come in, like the Department of Health, like the Joint Commission. I know with your situation, you were able to get the district attorney involved.
No, the district attorney refused to investigate. I've been reporting this for over 7 years, and I'm still reporting it to the authorities with the documents, because with my dad, it wasn't just one little thing. It was inhumane treatment straight down the line, from him not being properly anesthetized at intubation, no informed consent. My mother signed a document, and on the document it says that she's giving permission for fresh frozen plasma. That was filled in afterwards, but my father was not given fresh frozen plasma. He was given SD, detergent plasma. And apparently I haven't found the government agency that investigates this. Newsday published 2 articles a few years later about a company in Melville was producing this SD plasma. They were taking plasma from about 2,000 donors, mixing it with a detergent. It was killing people around the country. And I phoned the reporter to question about this SD plasma, and the reporter had no knowledge of any investigation in New York.
Right. Well, I know there are medications that either are expired or they're tainted and they're out of stock.
Questionable, to say the
questionable.
best.
And those medications, those products can be defective, and they can injure and harm patients in other way. You're absolutely right. I do remember, though, in your father's paperwork that there was a Department of Health finding that the consent wasn't proper for one of the...
Correct. There was no informed consent.
Yes, that there was a consent issue for one of the health care issues that your father underwent. I don't know whether it was the intubation or the medication that he received, but the Department of Health did cite that. And I have to say, though, that during emergency situations, that emergency situation is itself distracting. You try to do your best. And I do have to say that the great majority of times, the health care provider does have the best interest of the patient in mind. But it's these distractions that get in the way. Administrative distractions, phone calls, paperwork that needs to be completed. You need to do that work in a short period of time, the volume of patients that we need to see. That all causes distractions. And that's another way that medication errors or medical errors are increased. If we could find a way to increase the number of time, increase the time that a doctor or a nurse can spend with a patient, I assure you that that is going to reduce medical errors.
Let me ask you about bad doctors. Are there any bad doctors out there? They're just bad, they're incompetent,
well, I don't know what you mean by bad.
Depraved indifference, or they're
intentionally
just
bad.
they may be on drugs.
I doubt very much that there are intentionally bad doctors out there. And that's where I think the criminal issue is very difficult to bring to the DA's attention, or very difficult to investigate. You need to have some intent to cause a crime.
It has to be premeditated.
Well,
what about
always.
multiple billing?
Not
when
always.
a doctor causes personal injury and bills, let's say, 9 times.
Well, that is definitely going to change this year. The insurance companies, especially Medicare, Medicaid, and a lot of the other insurance companies, are no longer going to reimburse hospitals and doctors for care that flows from an injury or patient damage that should not have happened.
But now what is the patient supposed to do? Let's say the patient is injured and Medicare refuses to pay.
Again, you're right that that particular patient may not be helped. However, the insurance companies are hoping that if the hospitals and doctors know that they're not going to be reimbursed.
They're not going to profit from the injuries and errors.
Okay, it's another way to look at it. If they're not going to profit from the injuries and errors, that they are going to do their best, their 100% best, to try and reduce those errors and minimize the damage and minimize the deaths. I'm going to be interested to see exactly how that works this year and how it helps. It may. The medical error reduction must occur at the hospital level. There has to be more administrators that get involved with patient care. They need to set aside the profits that they're concerned about. Right. They need to stop putting profits ahead of patients. They need to concentrate on the patients themselves and put patients before profits. And that is a job of the administrators. They need to reinforce that. They need to remind doctors, remind nurses that the patients always come first. Before the paperwork, before the phone calls. We all need to stop and realize that the patients come first.
I would like to see more honesty and more integrity, that there is a problem. I would like to see where they admit to it and compensate the victims.
Well, there is a fear in the medical community today, and I also have that fear, that if we were to report something, we would be punished not only at the hospital level, but at the state level, at the licensing level, in the civil courts. We're all afraid of that punishing, and we're always afraid to admit that we've done something wrong. So you're right, there are times that we sweep things under the carpet. There are times that we sugarcoat problems. We're frequently saying, well, that patient would have died anyway. And
that's a very dangerous statement. That patient would have died anyway.
It is a very dangerous statement. You're absolutely right. And we're hoping to minimize the number of times we say that statement, that the patient should have died anyway.
Because or would have died anyway. Because
hastening a death
is wrongful death.
As causing a death.
Right, that's
yes.
wrongful death.
Yes.
That's when they hasten a death.
Yes. There are many things that need to be corrected. I'm hoping a program like this will bring these issues to the attention of the public, that they will start investigating it on their own. You can get on the internet. You can find out about certain hospitals, you can find out about doctors, you can find out about nurses, you can find out about pharmaceutical companies. There's so much information out there. You can find out about medications that you're getting or a family member is getting. Everyone needs to take an active role in their health care.
Absolutely. Exercise more, eat right, try and cut back on stress.
Yes.
So basically that's what, if you take care of yourself, you won't need the medical community as much.
That's a totally different topic, preventable medicine, and there are doctors out there that specialize in preventable medicine. If you can prevent your medical condition, that's always best, and you touched upon a lot of them: keeping your weight down, exercising, eating the right kind of foods, having a diet that's low in fat, that's high in protein, that's high in complex carbohydrates.
A balanced diet.
A balanced diet.
Reducing stress.
Oh, that I can't tell you how important that is. I can tell you, working in the hospital, that's a very stressful situation.
I'm sure.
Having a patient's health care in mind, it's very stressful. That alone is very